I don't remember the accident, but I do remember waking up to a doctor, and he said, "Emily, you were in a horrible car accident. You lost your leg." And I just thought it was a nightmare, so I ended up closing my eyes. I was in a sedated coma for about a week, and I woke up. It was the reality. It was true.
She had some catastrophic injuries from a motor vehicle accident. The most extensive extremity injury was a mangled right lower extremity and traumatic amputation. She lost the limb with the trauma. So in addition to that, she had a compound tibia fracture on the left. She had a pelvis injury as well as a severe injury to her thoracic spine. In the regular community trauma centers, an injury like Emilee's wouldn't be dealt with. It would be sent here, because this is what we do. It starts the first person to see a trauma patient. They will then call in consultations to any number of specialties, and we're on call 24 hours, 7 days a week. There's someone right at the door. So once she was stabilized from a hemodynamic standpoint, her blood pressure and vital signs were stabilized, the next steps were reconstructive. The number one goal with her on the traumatic amputation side is to save that knee joint. We have great prosthetics now that we can attach almost anything to a small piece of tibia left attached to the knee. So that is our number one goal in a patient, especially in her age bracket and function level.
I was in Cooper for 5 months. It was a very emotional time for me. I remember just letting it all out, screaming, crying, asking God, why did he save me? But the nurses and the doctor, they were right there. They gave me moral support. They were there when I cried. They were there when I laughed. And I couldn't ask for any better nurses.
Her attitude remained spotless throughout all of it. I mean, if you wanted to hold someone up as a beacon of hope, I think Emilee's your patient. When we see her, you smile, right? You smile because she came from really devastating injury to a spot in their life where, she's going to function pretty well for the rest of her life. And that's huge for us. I mean, there's nothing that gives you more satisfaction in this job than that.
3 years later, after recovering from my accident and surgeries, I am 8 months pregnant, and I will be delivering in Cooper as well. Your life doesn't stop after an accident. Your life just begins again. Walking into Cooper, where I've recovered, where they saved me, and also knowing that I have given life here. Very eventful chasing Abigail around with a prosthetic, but I think chasing Abigail around, even if with 3 legs, it would be pretty tough. In order for you to thrive, in order for you to continue your journey, you have to look at the positive. And I look at all the great things, like the nurses, Cooper. I met a lot of amazing people throughout my journey. I can never thank Cooper enough.